In our morning rounds, a new survey just out this morning finds money is the #1 factor in stress despite the improving economy. 29% of Americans report their financial worries intensified over the past year. Money topped the other big concerns: work, family, and health. Shannon Bennett is an assistant professor of psychology at Weill Cornell Medical College. Shannon, good morning.
Good morning.
So finances are the #1 source of stress. We've known that to some degree. Why do you think that's the biggest feeling that people have?
Well, I think despite the fact that the economy is improving, Americans are still concerned about money. Particularly, the study shows parents, individuals from low-income families, and young people, young adults are worried and stressed about money.
What are they most stressed about, the young people? Because, and when you say young, what age range are you talking about?
Well, the study was looking at millennials and Generation Xers. In the mental health community, we are increasingly focused on young people around age 18 to 25 or 28. And there's a number of things to be stressed out about in that period of life. The stage of development is emerging adulthood, burgeoning independence, figuring out your identity, career, finances, relationships, where you're going to live, and all of these things are often in transition, and that's inherently fairly stressful.
As you get older, you might think that health would become a major stress factor.
That would be true as well, and I think there's interesting correlations in the study between stress and health. One of the interesting things that I saw is that people who are stressed are so worried about money they may be likely to skip their doctor's appointment.
Yeah, that was one of the 1 in 5 Americans skipped or considered skipping necessary doctor appointments in the past year because of money concerns. That's not a good thing.
That's very concerning.
Yeah.
Who feels more stress, men or women?
The study shows women are reporting higher levels of stress.
Why?
That's a good question. Women may be more stressed out. They may also be more likely to report the stress that they're experiencing than men are. Both men and women said that it was helpful to have people to talk to, and that emotional support or active coping strategies were helpful for their stress.
What is the physiological impact on your body from stress? What do we see happening physically?
Acutely, in the moment when you're stressed, there's a lot of physical symptoms that one can experience: headaches, stomach aches, difficulty sleeping. There's a lot of, it feels very uncomfortable to feel stressed or anxious, particularly chronic stress or anxiety.
You said you treat a lot of anxiety in your own practice. Are those very closely related, or are they different things, stress and anxiety?
Stress and anxiety are different. But stress and anxiety can go hand in hand. We know stress can leave us vulnerable for anxiety disorders, for depression, as well as for a host of other medical or physical health concerns.
Okay, and just leave us with one thing other than meditation, one thing you can do.
I would say exercise is a great stress reliever.
Exercise.
Any active coping strategy, not avoiding the things that you're stressed out about.
Thank you, Dr. Shannon Bennett, for coming today.
Thank you for having me.